You're having trouble having sex. You are stressed about it. You are thinking about it, and it's affecting your quality of life because you're not in the moment. I'm Dr. Reena Malik, urologist and pelvic surgeon, and welcome back to the Reena Malik MD podcast. Today we have our monthly AMA. We are going to be answering your questions from our membership and our subscribers. Many men notice it quietly. Erections that once felt strong and effortless start feeling softer, slower, or less reliable. It's easy to dismiss it as stress or aging, but what if it's actually your body trying to tell you something deeper? Because the quality of your erection isn't just about performance. It's a reflection of your blood flow, your hormones, and even your overall metabolic health. When an erection loses its firmness, it's often one of the earliest signs that your body's internal balance, especially your vascular system, needs attention. Erection quality is one of the most sensitive indicators of a man's vascular health. To understand why, it helps to look at how erections actually occur. An erection is not just about arousal, it's primarily a blood flow event. When the brain signals arousal, rushes into the penis through arteries that are extremely small, about 1 to 2 millimeters wide. These arteries supply the corpora cavernosa, two spung-like chambers that expand and harden as they fill with blood. For the erection to stay firm, the veins that normally drain blood from the penis must close off to trap the blood inside. This entire process depends on smooth, flexible, healthy blood vessels. Now, here's where it becomes a powerful health clue. The arteries in the penis are much smaller than those in the heart, neck, or brain. Because of this, they are the first to show the effects of reduced blood flow. Amount of plaque buildup that might not yet affect the heart can already make a noticeable difference in erectile firmness. Changes in erection quality often appear years before someone is diagnosed with cardiovascular disease. Many doctors now consider erectile function to be a vital sign of vascular integrity, much like blood pressure or cholesterol levels. When blood vessels lose their ability to expand properly, it's often due to damage to the endothelium, the inner lining of the arteries. This lining is crucial because it releases nitric oxide, a molecule that tells the vessels when to relax. When endothelial cells are exposed to high blood sugar, smoking, pressure, or chronic inflammation, they produce less nitric oxide. Without enough nitric oxide, the smooth muscle in the penile arteries stays tense, can flow in. The result is a weaker or less sustained erection. Erectile softness or inconsistency can therefore be an early sign of broader vascular dysfunction. Research consistently shows that men who develop erectile problems often have an increased risk of heart attack, stroke, or peripheral artery disease within the following years. Doesn't mean every man with mild erectile changes has heart disease, but it does mean the vascular system deserves a closer look. Addressing erection quality isn't only about restoring sexual confidence. It's a chance to catch underlying cardiovascular issues early when they're most reversible. The firmness of an erection depends largely on a molecule called nitric oxide, which acts as the body's natural vasodilator. Nitric oxide is produced by the endothelium, the thin, delicate layer of cells lining all blood vessels, including those in the penis. When the endothelium is healthy, releases nitric oxide efficiently in response to stimulation, allowing the smooth muscles in the penile arteries and the corpora cavernosa to relax. This relaxation opens the vascular channels, letting blood flow freely into the erectile tissue. As the chambers fill with blood, they expand and compress the surrounding veins, trapping the blood and maintaining rigidity. In other words, nitric oxide is the chemical switch that turns psychological arousal into a physical erection. They arise when the endothelium becomes damaged or dysfunctional. Factors such as chronic inflammation, oxidative stress, diabetes, smoking, high cholesterol, and hypertension impair nitric oxide production or availability. When this happens, the arteries cannot dilate as effectively, and the smooth muscle tissue becomes less responsive to the signals that trigger erection. Even if sexual desire and hormonal levels are normal, the physical ability to achieve full firmness can be reduced. This is one of the main reasons why men with cardiovascular or metabolic conditions frequently experience weaker erections. They are not just experiencing an isolated sexual problem, rather a systemic vascular issue. Nitric oxide synthesis begins with an amino acid called L-arginine, which is converted into nitric oxide by an enzyme known as nitric oxide synthase. This process requires oxygen and several cofactors such as tetrahydrobiopterin. However, oxidative stress is high, meaning there are too many free radicals in the body. These cofactors become depleted, and nitric oxide gets destroyed before it can do its job. Result is less blood flow and less erectile firmness. Even psychological stress can play a role, as elevated cortisol and adrenaline levels constrict blood vessels and interfere with nitric oxide signaling. Scientific research has consistently shown that men with higher endothelial function, measured through vascular tests, tend to have better erectile quality. Conversely, nitric oxide activity is one of the earliest detectable signs of vascular aging. Improving nitric oxide availability through regular exercise, weight control, adequate sleep, and a diet rich in polyphenols and nitrates found in foods like leafy greens and beets can restore endothelial health and enhance erection quality naturally. Testosterone plays a central but often misunderstood role in erection quality and overall male sexual function. It is not just the sex hormone responsible for libido. It influences nearly every system involved in achieving and maintaining an erection. Testosterone affects the brain's sexual motivation pathways, nitric oxide synthesis, and even the structural integrity of penile tissue. When levels are optimal, it supports confidence, energy, and the biochemical signals that drive sexual performance. But when testosterone is low, subtle changes can begin, desire declines. Arousal takes longer, and erections may feel less firm or less frequent. Testosterone interacts closely with the endothelial cells and smooth muscle of the penis. Research shows that it helps regulate the activity of nitric oxide synthase, the enzyme that converts L-arginine into nitric oxide. Without sufficient testosterone, this enzyme becomes less active and the body produces less nitric oxide. That means less relaxation of penile blood vessels, less blood flow, and weaker rigidity. Testosterone also helps maintain the density and responsiveness of androgen receptors in penile tissue. These receptors are essential for proper vascular and muscular response during arousal. Over time, chronically low testosterone can reduce this sensitivity, making the erectile tissue less reactive to normal stimulation. Beyond the penis itself, testosterone has systemic effects that indirectly influence erection quality. Supports red blood cell production, muscle mass, and energy metabolism, all crucial for vitality and stamina. When levels drop, fatigue becomes more common, increases, and insulin sensitivity declines. These changes can contribute to metabolic syndrome, which is a major risk factor for erectile dysfunction. In this way, testosterone can create a cycle where reduced energy and increased inflammation further impair vascular and sexual health. However, it's important to understand that testosterone is not the sole cause of erectile problems. Many men with low levels still achieve functional erections, while others with normal levels experience difficulties due to vascular or psychological issues. Testosterone's role is more about optimization. It amplifies the signals and physiological processes that make erections more reliable and satisfying. In clinical research, restoring testosterone in deficient men often improves sexual desire, frequency of morning erections, and response to other treatments such as PDE5 inhibitors. But it is rarely a cure on its own. Several factors can contribute to lower testosterone levels, including chronic stress, poor sleep, excess body fat, alcohol overuse, certain medications. The natural decline with age also plays a role, but the rate of decline can vary greatly depending on lifestyle. Sleep, in particular, is crucial. Most testosterone is produced during deep, slow-wave sleep. Men who regularly sleep less than 6 hours a night often show measurable drops in testosterone and libido. Likewise, resistance training and adequate dietary fat intake, especially from sources like olive oil, eggs, and avocados, support healthy hormone production. From a biological perspective, testosterone acts as both a signal and a support system for sexual health. It tells the brain that the body is ready and capable, and it ensures the tissues respond accordingly. When that signal weakens, the entire system becomes less coordinated. Addressing testosterone balance, therefore, isn't just about increasing a number on a lab test. It's about restoring communication between the brain, blood vessels, and body to bring sexual health back into harmony. Erections are as much a neurological and psychological process as they are a vascular one. The brain is the command center that initiates, maintains, and even ends an erection. When arousal begins, sensory and emotional cues activate specific regions in the brain, such as the hypothalamus and limbic system. These regions send signals down the spinal cord through the parasympathetic nerves, instructing the penile arteries to release nitric oxide and dilate. Proper communication between the brain and body, even perfectly healthy blood vessels, cannot achieve a strong erection. However, this delicate signaling system is highly sensitive to psychological and environmental stress. When the brain perceives stress, anxiety, danger, whether real or imagined, it activates the sympathetic nervous system, also known as the fight or flight response. This system releases adrenaline, which constricts blood vessels, increases heart rate, and directs blood flow away from non-essential functions like sexual activity. In simple terms, the body cannot focus on reproduction when it believes it needs to survive. As a result, chronic stress or anxiety can interfere with the erection reflex, causing inconsistent or softer erections even when physical health appears normal. Performance anxiety is a common example. When a man begins to worry about his ability to perform, the stress hormones released by that worry directly inhibit the parasympathetic response required for erection. The more he focuses on trying to get hard, the harder it becomes. Similarly, frequent pornography use can alter brain reward circuits, changing how arousal is triggered and reducing sensitivity to real-life stimuli. Over time, the brain becomes conditioned to specific artificial cues, and natural arousal may feel weaker or less engaging. Sleep also plays a critical role in neurological regulation. Most men experience several erections during REM sleep. Maintain penile tissue health and oxygenation. Poor or fragmented sleep disrupts this cycle and reduces both testosterone and dopamine, key chemicals that influence sexual motivation and pleasure. The nerves involved in erection, particularly the pelvic and pudendal nerves, must remain healthy and responsive. Conditions like diabetes, spinal injury, or excessive alcohol use can damage these nerves, reducing signal transmission. But even without physical nerve damage, emotional fatigue, depression, or chronic overstimulation can desensitize these pathways. Supporting mental health, managing stress, maintaining regular sleep, and exercise routines can reestablish proper neurological balance, allowing the brain and body to communicate effectively for consistent erections. The pelvic floor muscles play a surprisingly significant role in erection quality, yet they are often overlooked. These muscles, particularly the bulbocavernosus and ischiocavernosus, act like a natural pump, helping to trap blood in the penis and maintain rigidity during an erection. When these muscles contract, they compress the base of the penis, limiting venous outflow and effectively locking in the blood that has filled the corpora cavernosa. Without sufficient muscle tone, even healthy blood flow may not result in firm, lasting erections because the blood can escape more easily, leading to softer or shorter-lived rigidity. Muscle weakness in the pelvic region is often a consequence of sedentary lifestyles, aging, or lack of targeted exercise. Sitting, obesity, and poor posture can all reduce pelvic floor strength over time. Men may notice this weakness as a subtle change. Erections may feel less full. Maintaining firmness during prolonged activity becomes more difficult. Strengthening these muscles through specific exercises, such as Kegels, can enhance the ability to sustain erections and even improve ejaculatory control. Beyond their mechanical role, pelvic floor muscles also interact with the nervous system. Strong, responsive muscles enhance flow through the area and provide sensory feedback that reinforces arousal signals. Conversely, tension or dysfunction in these muscles can contribute to discomfort, premature release, or difficulty achieving maximum firmness. In addition, oxygenation of the erectile tissue is influenced by pelvic floor activity. Contractions during arousal increase circulation to the penis, delivering oxygen and nutrients that maintain tissue health over time. Regular engagement of these muscles through exercise or mindful activation supports both short-term performance and long-term penile health, making the pelvic floor a crucial, though often underappreciated, factor in achieving and maintaining strong erections. Systemic inflammation and metabolic health are closely linked to erectile function, yet many men overlook their impact on sexual performance. Inflammation in the body, whether caused by poor diet, obesity, chronic stress, underlying medical conditions, directly affects blood vessel health. When inflammatory molecules circulate, they damage the endothelium, the inner lining of arteries responsible for releasing nitric oxide. Reduced nitric oxide means blood vessels cannot dilate properly, limiting blood flow to the penis and resulting in weaker or inconsistent erections. Even low-grade chronic inflammation that doesn't produce obvious symptoms can subtly impair vascular function over time. Metabolic disorders, particularly insulin resistance and type 2 diabetes, further exacerbate this problem. High blood sugar damages small blood vessels and nerves, including those essential for erections. Over time, the combined effects of inflammation and metabolic dysfunction reduce nitric oxide availability and interfere with smooth muscle relaxation in the corpora cavernosa. Poorly controlled blood sugar may notice softer erections or difficulty sustaining firmness, even if they are otherwise healthy. Elevated triglycerides, abdominal fat, excess visceral fat are additional contributors as they increase systemic inflammation and worsen endothelial function. Lifestyle factors play a central role in both inflammation and metabolic health. Diets high in processed foods, added sugars, and unhealthy fats promote chronic inflammation. Nutrient-rich foods such as leafy greens, berries, nuts, and fatty fish support vascular and hormonal health. Regular physical activity improves insulin sensitivity, reduces inflammatory markers, and enhances endothelial function, all of which contribute to firmer, more reliable erections. Conversely, Sedentary behavior not only weakens vascular tone, but also diminishes nitric oxide production, compounding the problem. Sleep and stress management are also critical. Sleep deprivation elevates inflammatory markers like C-reactive protein, while chronic stress increases cortisol, both of which impair endothelial function and reduce nitric oxide synthesis. Even moderate improvements in sleep quality, stress reduction, and consistent exercise have been shown to enhance both vascular health and erection rigidity. Addressing inflammation and metabolic dysfunction is not simply about sexual performance. It's about restoring the overall biochemical environment in the body that allows the vascular and hormonal systems to operate efficiently, ensuring that erections reflect true health rather than being hindered by preventable internal factors. It's important to put the concept of erection hardness into a realistic perspective because many men measure their sexual health by the rigidity of their erections alone. A firm erection can be a sign of healthy vascular and hormonal function. It is not an absolute requirement for sexual health or overall well-being. Erections naturally fluctuate throughout the day and across different circumstances. Factors such as stress, fatigue, alcohol intake, time of day, and even minor illness can influence firmness. Occasional softer erections do not necessarily indicate a serious problem. Persistent difficulty achieving or maintaining rigidity may signal underlying physiological or psychological issues that deserve attention. Understanding this variability is key to reducing unnecessary anxiety. Many men fixate on the idea that erections must be rock hard to be considered normal. This oversimplifies the complex interplay of vascular, neurological, hormonal, and psychological systems involved. For example, a man under stress may still have sufficient blood flow to achieve penetration, yet his erection may feel less firm than usual. Conversely, with excellent vascular and hormonal health may still experience temporary softness due to sleep deprivation or mental fatigue. Recognizing that erection quality is influenced by multiple, sometimes overlapping factors can help men approach sexual health with a more informed and balanced mindset. At the same time, consistent difficulties in achieving full rigidity should not be ignored. Such changes often precede or accompany broader health concerns, including cardiovascular disease, metabolic syndrome, or hormonal imbalances. Viewing erections as a window into overall health allows men to take proactive steps, such as improving diet, increasing physical activity, managing stress, optimizing sleep, and addressing hormonal concerns rather than relying solely on performance-focused interventions. It is also worth noting that realistic expectations and a broader understanding of sexual function improve both confidence and satisfaction. Sexual performance is multifaceted: intimacy, communication, stamina, and emotional connection. Hardness is just one element of a healthy sexual experience. Men who cultivate a holistic approach to their health often experience more consistent improvements in erection quality over time. By integrating lifestyle, medical awareness, psychological well-being, men can support erections that are firm, responsive, and sustainable, while also nurturing broader aspects of vitality and life satisfaction. Ultimately, how firm your erections are is more than just a measure of sexual performance. It's a reflection of your overall vascular, hormonal, and metabolic health. Paying attention to changes, understanding the underlying factors, and taking informed, practical steps can empower you to support both your sexual function and your long-term well-being.